Hello everyone, good morning. In this English class, I would like to explain about ICU nurse. What is ICU nurse? An ICU nurse is a specialized nurse who works in the intensive care unit or ICU of a hospital or medical facility. ICU nurses are highly trained and skilled in caring for critically ill patients who require intense monitoring, complex medical interventions, and constant attention. They play a crucial role in providing life-saving care and supporting patients with severe illnesses or injuries. The responsibilities of an ICU nurse can be diverse and demanding. Some of their duties may include 1. Monitoring vital signs. ICU nurses continuously monitor patients' vital signs such as heart rate, blood pressure, respiratory rate, and oxygen levels to identify any change of signs of physician's orders. 3. Managing life support equipment. ICU nurses are skilled in operating and managing complex medical equipment such as ventilators, cardiac monitors, and infusion pumps. 4. Assessing patients' conditions, deteriorations. 2. Administering medications and treatments. They administer a wide range of medications, fluids, and other treatments based on the patient's conditions, and they assess and analyze patients' responses to treatments and interventions, adjusting care plans as needed. 5. Collaborating with the healthcare team. ICU nurses work closely with the physicians, respiratory therapists, pharmacists, and other healthcare professionals to provide comprehensive care to the patients. 6. Providing emotional support. ICU nurses not only care for the physical needs of patients but also offer emotional support to both patients and their during stressful and challenging times. 7. Educating patients and families. They explain medical procedures, treatment plans, and recovery expectations to patients and their loved ones. Due to the critical nature of their work, ICU nurses must remain calm under pressure, families, and be prepared to handle emergencies quickly and efficiently. They often deal with life and death situations, making effective communication and teamwork essential in delivering optimal patient care. ICU nursing is a challenging yet rewarding profession as it allows nurses to make a significant impact on the lives of critically ill patients and their families. Well, students, now we are talking about a job description of ICU nurse, and Fitri now read what it is.
ICU nurse is also known as a critical care nurse. Critical care nurses provide most the direct care to patients in life-threatening situations within the intensive care unit. ICU nurses commonly provide care to patients suffering from cardiac disease, brain injuries, accident victims, and patients recovering from complex surgeries that need frequently nursing care.
Well, Permata, now what do you think about ICU nurse works in a hospital?
Intensive care unit nurses work very closely with physicians and other members of the healthcare team. They need to be skilled to assess patient problems quickly and capable to use high-tech equipment. They use their advanced skill to care for patients who are critically ill and at high risk for life-threatening health problems. Critical care nurses or ICU nurses must be physically, mentally, and emotionally strong to work with seriously ill patients and their loved ones. Most patients in a critical care unit are physically and mentally unstable, and they require respiratory and heart monitoring as well as treatment adjustments.
Yeah.
ICU staff RNS are responsible for managing medication doses, anesthesia, and ventilator support.
The next problem is duties and responsibility of ICU nurse.
Specific critical care nurse or ICU nurse duties and responsibility can include: number one, monitor, accept detailed report and records of the critical ICU patients. Number two, monitor and record symptoms and change in patient's condition and information to the physician. Number three, order, interpret, and evaluate diagnostics tests to identify and assess the patient's condition. Number four, carefully observe and document patient medical information and vital signs. Number five, document patient's medical histories and assessments findings. Number six, document patient's treatment plans, interventions, outcomes, or plan revisions. Number seven, consult and coordinate with healthcare team members about all patient care plans. Number eight, modify patient's treatment plans as indicated by patient's response and conditions. Number nine, monitor the critical patients for change in status and indications of conditions such as sepsis or shock and institute appropriate interventions. Number 10, administering intravenous fluids and medications as per doctor's order.
I think there are some other duties and responsibilities of ICU nurse, and now you go on this problem.
11. Monitor patients' fluid intake and output to detect emerging problems such as fluid and electrolyte imbalances. 12. Monitor all aspects of patient's care, including diet and physical
activity.
13.
Identify
patients who are at risk of complication
complications due to nutritional status. Mulai dari complications due
to nutritional status.
Terus
14. Direct and supervise skilled nursing healthcare personnel or supervise a particular unit on one shift to patients' response and conditions.
Response and conditions. Ada S tuh.
Response and conditions. 15. Treating wounds and providing
Bentar. Treating wounds and providing advanced life support.
Treating wounds and providing efficient life support.
15. Treating wounds and providing advanced life support.
Treating wounds and providing advanced life support.
Advanced life support.